Hello everyone, my name is Samrit Kaur and I am going to discuss challenging behavior biting in my presentation. Biting behavior can be one of the most stressful and divisive issue in early childhood setting. It impacts on everyone in early childhood community, educators, parents and children. Biting at a young age typically refers to the behavior exhibited by infants and toddlers in which they bite others or items with their teeth. Biting is a sensitive subject in early childhood contexts because a child is being injured and the parents of both the biter and the one who was hurt are upset. Biting can also be a sign of anger, anxiety, or other emotional or developmental issues. Although I have to discuss imaginary scenario here, but I borrowed a scenario which is from my real life experiences. Okay, I am going to discuss a biting scenario which is my real life experience. During outdoor playtime, 2.5-year-old child becomes frustrated because another child takes a toy he was playing with, and child A respond by biting another child's shoulder, and it's not the first time, it's his repetitive behavior. And the child who was bitten cries in pain. The teacher approached the bitten child and they separates them and teacher comforts the child who was bitten. Child A is questioned by the teacher, and child A is then directed by the teacher to engage in a positive activity. Teacher informs the parents of both children. Service response in regards to biting. First and foremost, document the incident. And behavior guidance policies are available in early childhood services to manage the challenging behavior like biting. Behavior guidance policy says service is dedicated to assisting children and in reducing their tendency to bite. Educators are committed to responding appropriately and professionally to the situation. Analysis of teachers' response and service response in regards to biting. In response to biting, teachers' response is appropriate, such as using clear language. It hurts my friend, it's not acceptable, and redirecting the child into a constructive activity are good strategies. However, apart from these strategies, it is essential to address the behavior and attempt to comprehend an underlying cause because biting is frequent and aggressive as well. Next, identify the reason behind biting and plan appropriate strategies. For example, if a child is biting due to teething, provide appropriate resources such as oral muscle teether, chewable bangle, etc. Share the strategies with families so that they can support child at home as well. Contributing factors to biting. Biting may occur when children is going through developmental stages such as teething, learning to walk, learning to talk, and developing feeding skills. For example, if a child is trying to walk and he is not successful, he get frustrated and he bites. And further, bite biting also linked to oral motor development because children use biting to alter their surroundings. Some researchers believe that biting is a part of oral development. For instance, a young child may bite or exhibit other aggressive behaviors if she or he is frustrated or doesn't get their way. The next reason for biting could be sensory integration. Children are able to react in behavioral, emotional, and intellectual ways when all of these senses are integrated and function well together. The foundation for moving, learning, speaking, and interacting with the world is sensory integration, or how the senses cooperate. An illustration of this is when an infant uses one sense, such as smell, to interpret information. Using sensory integration, we can decide whether the smell is pleasant or unsettling and how to react. Adults react when they smell smoke. Years of sensory training have taught us that smoke is hazardous and that we should react. Even pleasant smells can appear frightening to young children because experience until they realize that the sensory experience is positive. Next factor is behavioral organization, the ability of an individual to act or react in a manner appropriate to the circumstances. For instance, a child behaves differently at the dinner table when eating with just his siblings versus when the parents join them. With this skill, a person can modify their reaction in accordance with the evolving demands of the circumstance. Children who have developed behavioral organization are able to use their senses to respond appropriately, such as an infant sucking on a pacifier to feel calm. If any of these development is in processing, it has not been developed yet. Child get frustrated and he bites. Strategies to manage the behavior. Observe the child, identify the cause of the behavior, and provide appropriate opportunities to manage the behavior, such as if biting is linked to oral development, offer foods to suck like yogurt smoothies, milkshake, juice bars, etc. The next strategy is children's engagement, and in turn their behavior are significantly impacted by the learning environment. Reflect on the curriculum and the learning setting to make sure it is stimulating enough to encourage exploration, independence, problem solving, and critical thinking. Offer guidance on how to avoid being bitten by other children. Follow service policies and procedures to manage behavior. Encourage parents to work cooperatively to manage the behavior. Set boundaries and use clear language like this is not acceptable. It hurts my friends. Supportive relationships and interactions will work. Intentional and meaningful connections with each child every day. Children gain self assurance, a sense of respect, and a sense of value through a strong network of safe relationships. Their capacity to understand, appreciate, and engage in constructive interactions with others' feelings grows. Pyramid model for promoting social emotional competence in infants and young children. These approaches support the pyramid teaching model's emphasis on encouraging young children's healthy social emotional development, building helpful and accommodating learning settings, and taming their troublesome behavior. The pyramid model would focus on the importance of comprehending and addressing the cause of the behavior, supporting positive behavior, and creating a safe and stable environment when managing challenging behaviors like biting. Links to national quality standards and early year framework. Quality Area 2, Children's Health and Safety. Each child is protected. Quality Area 5, Relationships with children. As we discussed earlier, positive relationship and interactions will support children's behavior. Each child is supported to build and maintain sensitive and responsive relationships with other children and adults. Early years learning framework. Strategies to pedagogical strategies to manage the behaviors, holistic approaches towards the behavior, responsiveness to children, Learning through play, intentional teaching will help, learning environments will help, as we discussed earlier in the strategies, cultural competence, continuity of learning and transitions, and continuous assessment for learning will help.